Welcome to this lecture in basic pharmacology, and today we are talking about, or we are going to have a series of lectures in what we refer to as pharmacodynamics. And the D has been stressed in the word pharmacodynamics because in a layman's language you would take it as what the drug does to the body. And so here in this series of lectures, we shall be able to define what pharmacodynamics is and how or what entails pharmacodynamics. So we should be able to talk about receptors and how they work, what drugs operate through receptors, what are the functions of receptors, among other things in this topic that we shall talk about. So to start, remember we said pharmacodynamics is what the drug does to the body. But in more technical terms, we could refer to it as the study of biochemical and physiological effects of drugs and their mechanisms of action. So in other words, we are saying that what do these drugs do to the body's physiology and biochemical what do they do to the body's physiology and biochemical functioning of the body, and basically how do they work? Yeah, so that is what entails what we refer to as pharmacodynamics. Now, it should also be noted that most drugs basically have their effects, or they work through what we refer to as receptors. And so for any drug to act, of course we are going to see that there are some drugs that do not necessarily need to work with receptors, but most of them work with receptors. So in other words, for us to have a response, for us to have a biological response because out of this drug, then this drug needs to bind to what we refer to as the receptor. And so what is a receptor? Basically, receptors are specialized macromolecules, that are usually proteinous in nature, but of course not all of them are proteinous in nature because some are DNA, So, but they are specialized macromolecules that are present either on the cell surface or within the cell surface, and onto these drugs basically bind so that we can have a biological response. Now that is what we refer to as a receptor, and we are going to see that a receptor has two sites. It has what we call the drug binding site, or what we call the ligand binding site, and then it also has what we refer to as the effector site. Now those are the two sites for a receptor. Remember we said about the location of this receptor. They are either located on the cell surface membrane or inside the cell. And when this drug binds, to the ligand, when the drug binds, so in other words we are saying when the drug binds to the receptor, we form what we call a drug receptor complex. We form what we call a drug receptor complex, and it is this drug receptor complex that will basically give us what we call a biological response. So in other words, the drug has to bind to the receptor, and where it binds is what we actually, that site is what we call the ligand binding site, or the receptor site. And once it binds, then we see a series of changes or transduction changes, and so we eventually have a biological response. Now there are thousands of receptors, yeah? There are thousands of receptors on the cell surface membrane or even inside where drugs have to bind. And it is, as we shall see, some of the functions of, or rather the properties of receptors, that these receptors are actually ligand specific. They are ligand specific. If it is not its ligand, then it will not be able to cause or bring about a biological response. And cells may also have different types of receptors, each of which is specific to a particular ligand, as we said earlier on. Now, how do drugs work? How do drugs work? Drugs work in these some of these ways. One, they can act to replace or substitute what we refer to as the missing chemicals, or they can be used to increase or stimulate certain cellular activities, or they can be used to depress or lower what we refer to as cellular activities. But also they can interfere with the functioning of foreign cells. And so in detail, we are saying that by stimulation, these cells enhance, they enhance the level of activity of specialized cells. Like, for example, adrenaline stimulates the heart to pump faster, because adrenaline has receptors within the heart, which we refer to as the beta-1 receptors. So once adrenaline acts on the heart, it will make it pump faster, so that we have a higher cardiac output, but also a higher heart rate. Not only does it do that, but we also have drugs like pilocarpine, which stimulates the salivary glands to secrete more saliva, and so in a nutshell, we have stimulation. Yeah? In other words, drugs do stimulate organs or tissues to be able to enhance their activity. Now, the other way how they work is basically depression. Yeah? So here we mean, by depression we mean to lower the activity. It is just like the opposite of stimulation. And a very good example here are some of the drugs that are given to lower or to depress the central nervous system firing. And one of them is, examples like barbiturates, like phenobarbital. These help to depress the central nervous system, so that a patient who would be convulsing, would basically, then the convulsing or the seizures would actually stop. And in that case, we are saying that they are using to depress. We also have other examples, like, for example, beta blockers that are used in hypertension. These are used to depress, the heart, and essentially we have a lowering of the heart rate, but also the cardiac output. Now, the other way how they work is through what we refer to as irritation. And here, often a noxious effect, and is particularly applied in less specialized cells. Like, for example, if you have a mild form of irritation, then you have this organ or this tissue, secrete more. Like, for example, when you have a mild secretion, this might, or like, for example, with bitterness, this enhances, the salivary glands, or even the stomach to secrete more gastric juices. However, if the irritation is strong, then it is actually dangerous, and this is where you see things like inflammation, corrosion, or even necrosis, plus other associated morphological changes. I'll give you an example. If you overtake NSAIDs, like, for example, ibuprofen, diclofenac, you end up corroding the stomach walls. So that is a strong form of irritation that basically leads into corrosion, which is not good at all. Now, the other way drugs work is replacement. Yeah, you might not have some maybe constituents in the body, and so when you're given these drugs, they act as a replacement. Like, for example, levodopa, which is given in Parkinsonism to substitute for the deficient dopamine, yeah, and insulin that is given in patients with diabetes, and also, like for example, iron that is given in anemic patients. The other way is cytotoxicity, and here basically what happens is that we give drugs to counteract the evading either microorganisms, like for example antibiotics, or parasites, or even the over rapidly multiplying cancerous cells. Yeah, so in here drugs are given for the purpose of creating what we call a cytotoxic effect. In other words, they end up killing the foreign cells. Now, remember we said most drugs work through receptors. However, not all drugs will work through receptors. And before you see a chart that is basically depicting the mechanism of action of some drugs. And you can see very clearly those that work through receptors, like for example, those that work through G protein-coupled receptors, drugs like acetylcholine, drugs like norepinephrine, and others, as you can see. These work through receptors. However, we have those that do not necessarily need receptors. Like, for example, we have what we call ACE inhibitors. These are very good drugs that are given in hypertension. Yeah, angiotensin converting enzyme inhibitors. They do not necessarily need receptors. Instead, they physically block the enzymes, the angiotensin converting enzyme. We also see some anti-cancer drugs, and we also those that provide a barrier, yeah, or do what we call physical interaction, yeah, like for example antacids, yeah, which physically interact with the acid. We also have drugs like mannitol, and drugs like bisphosphonates, yeah, we shall find them being used in some conditions of the bones, yeah. So that chart is essentially trying to show us that there are some drugs that work through receptors, and there are some that do not necessarily work through receptors. Now, when we come back, we shall look at the functions of receptors and also how these receptors work. Thank you.